PT art for about a year. I've been working in the field for 4 years, and I live in Philadelphia, Pennsylvania. I decided on a career of art therapy when I was about 13, which is pretty early, actually. A lot of people I know didn't really know they wanted to be an art therapist then. I went to a summer arts camp at Goucher Institute in Maryland, actually. And one of my teachers there was also an art therapist. And so he really introduced me at that point to the healing powers of art that I'd always felt. How art was cathartic, how I felt like I could express myself, how I felt intrinsically just tied to image making. It's just, you know, if you're in that, you just know what I'm talking about, you know. And if you're going to become an art therapist, I think that a part of you really has to kind of know what I'm talking about as image making, as just kind of naturally a release, a method of expression and communication. So I decided on a career in art therapy about that time when I heard about it. I'd always been really interested in psychology and human behavior. And so when I heard about art therapy, it was kind of like both of those fields just really like merged together. This art making that I love as an artist, and also this, you know, field of psychology, the study of human behavior. And it was like this perfect marriage. So that's when I was like, I definitely want to become an art therapist. What message or advice I have is probably just to really always try to be in touch with your own art process. And I know that it's often difficult with our schedules, and it's often difficult, especially when you become a working professional, to kind of like integrate that and make sure you have time for art making. But you will find that it is really essential because it always connects you back to the essence of what we do as healthcare professionals, and that is using art as a mechanism for expression and healing, and really being in touch yourself with that. So I would really, really advocate for making some sort of time consistently to always be in contact with your own art process and yourself. So changes I'd like to see in the field in the next 5 years, I've been hearing a lot about research, and I'm totally in line with that. I think that our field is really always in need of more research, measurable research, quantitative research. You know, healthcare is luckily something that's always going to be present, but we need to be able to really communicate to the rest of the world what we do is effective, because it is, but we need to meet them where language is at in the overall population. So research is definitely something that I'd like to see. In my opinion, the best thing about being an art therapist is just knowing that I'm using something just so inherent about, you know, how I feel that art is just so expressive, and I can help others connect with that self, because I really feel like everybody can connect with that part of themselves. That art is an expressive tool. So I feel privileged. I feel really privileged to work where I am most of the time. I work with people who have chronic mental illnesses, and it's a very challenging population, but it's so rewarding because it's so promising to see these moments of hope